Assume we don't have to do those anymore, right? And so, welcome everybody. Nice to see everybody here. We've got a great agenda today, and so we're going to start. My name is Paul Hoffman, and I'm the president-elect, and I'm filling in for Tressa Holmes, who was called ahead today. So welcome everybody. It's so good to see everybody here. Really nice to see everybody. So today's meeting is sponsored by Julie Swenson of Forward Theater Company. I see Forward Theater has a show coming up called the Medellinian Debate by Quan Berry. It's the world premiere, and so we're super excited to have that go forward. So thank you, Julie, for sponsoring, and really look forward to seeing the show. I can't wait to go out to do that. So if you haven't got your tickets yet, please consider that, because it is going to be the world premiere, and it's a great and really excellent show. So thank you, Julie. Thanks for being here. And so with that, we'll open our meeting with some music like we always do. So if you have your face mask off while you're eating, please put it back on while we sing. And Heidi Frankson will lead us in singing America the Beautiful with Elaine Mischer on piano. Hey, Heidi.
Oh, beautiful for spacious skies, for amber waves of grain, for purple mountain majesties above the fruited plain. America, America, God shed his grace on thee, and crown thy good with brotherhood from sea to shining sea.
Awesome. Thank you, Heidi. Thank you, Elaine. And Laura Gallagher is going to come up and introduce our guests. Laura?
Good afternoon. I'm going to say your name, and then I'd like you to stand, please, and remain standing. So first, we'd like to welcome from the Rotary Youth Exchange, Jennifer Durkee, Matt Durkee, and Riley Durkee. Jared Markowicz, guest of Charles McLiminis, and Martin Lackey from the Middleton Rotary Club is here today. And then Ed Futa, who is a visiting Rotarian from Honolulu, Hawaii. Yes. Please welcome all of our Rotarians, all of our visiting guests today.
Thank you, Laura. All right, as Laura said, we've got some guests here as part of our Rotary Youth Exchange Committee. And so Janine O'Rourke, who heads up that committee, is going to come up and make some introductions. Janine?
Good afternoon. So I am so excited that we have Rotary Youth Exchange starting up again after being closed down for 2 years. It will slowly ramp back up, and in July, Youth Exchange is again approved by Rotary International. And so Riley Durkee, who is a sophomore at La Follette High School, will be headed out to Chile for the academic year starting this August. And so she is she's already fluent in Spanish, having gone through a dual language immersion program for most of, I think, her education. She's also studied a little bit of Korean at a UW-Madison program, and is really excited to have this new experience. And her parents are here with her. I know she has 2 sisters that are really going to miss her, but we're really excited for her opportunity.
Thank you, Janine. You've done just an excellent job as chair of the committee. It's been a tough time to kind of keep that going, and I really appreciate all the work into it. The Rotary Youth Exchange is very close to my heart, so thanks for all your hard work for that, and best of luck to you, Riley. I'm sure you're going to have a fantastic experience in Chile, so that's really exciting. All right, and with that, past President Andrea Kaminsky, who chairs our classification committee, has a report. So, Andrea? Oh, there you are. Thanks.
Thank you, Paul. Yes, I'm Andrea Kaminsky, and as the second to immediate past president, I get to chair the classification committee for our club. Now, as you may know, our Rotary Club is based on a classification system, and each of us, when we join, we're each assigned one of 40 broad classifications. And the purpose of this system is to maintain diversity among the professions that are represented in our membership. So, and it enables you to sit at a table with a butcher, a baker, and a candlestick maker, and others, and network with people outside your own area. So club policy allows us to have up to 10% of our membership, which this year would be 41 active members in one of our 40, in each of our 40 broad classifications. Note that retired members are not included in that 10%, so we are in a class unto ourselves. The classification committee has 5 members, and we meet monthly to review the membership nominations that come in each month. Look to see that the individuals have the qualifications of membership, assign them a classification, and then submit the recommendations to the board for approval. One of the recommendations from last year's strategic planning efforts was to have the membership recruitment task force select 5 underrepresented classifications each year to focus our recruitment efforts. We were finding that we've been getting really close to that 10% limit or even at capacity on some of our classifications, and this is a more strategic approach that was adopted to address that. Now, there's a listing of our current classification list, classifications and the number of members in each on your table, and it's also showing on the screen. And if you can't see it, you can also find one there are a couple of them at the table in the back of the room, and it's also on the members only website. The 5 classifications that are being prioritized for this year are in bold on that sheet or on the board, though you can't see it. And they are advertising, publicity and public relations, religion, financial institutions, health services, and science and technology. So each of these classifications currently has far less than the allowed 41 member limit. And at the other end of the scale, community services, consulting, and law all have a much larger representation. So if you have a colleague, a friend, or family member, and you think they'd make a great Rotarian, invite them to lunch, and so they can see what Rotary is like. And then see if they're interested in joining, and then you can nominate them to be a member. The main reason why a leader in our community isn't a member of Madison Downtown Rotary is they've never been asked. So we got to get over that. So let's get connected to new Rotarians, especially those in the 5 areas that I outlined. Now, there's one more topic I want to call to your attention, and that's that the classification committee asks all current members to review your own classifications to be sure you're in the right place, and that our listings are accurate. So we have a printed copy of each listing as I said, at the tables, and we're also going to include a link to that in Friday's email, so you can find out where you are listed. So take a look at it, and if you feel you belong in a different classification or even a new classification, one that isn't on there, then send an email to the Rotary office with your suggestion. And the classification committee then will review all such requests at our meeting. So feel free to contact the Rotary office or me if you have any questions about this. Thank you.
All right, thank you, Andrea. Really appreciate that and all the work you're doing on that committee. So I wanted to mention that we have 2 annual Rotary conferences where our members can connect with other Rotarians outside of our club while learning more about Rotary. The first one coming up is our Rotary Tri-Con Conference. This is an event where our Rotary district joins with 2 other districts to hold a conference on Friday, April 29th, and Saturday, April 30th in Elkhart Lake, Wisconsin. They have a website with more details and where you can register, and that'll be included in Friday's email from the Rotary office. And the second annual event is the Rotary International Convention, which will be held June 4th through the 8th in Houston, Texas. So it's going to actually be live this year, and Rotary International has created a short video that's about 1.5 minutes, and Jane's going to play that for us now.
We are excited to invite you to 2022 Rotary International Convention, Houston, Texas.
There are no limits to what can be discovered.
Our horizons are changing, but we remain resilient.
Because it's in our nature to break down barriers.
To explore the vast world of ideas, culture, and experiences.
The very things that give us new meaning to life.
So what better time than now to take action
And push the boundaries of what's possible.
To join forces and do something that revitalizes the spirit.
Form connections that broaden our worldview. Share our passions for service with other leaders.
and become inspired to do great things along the way.
Let's take on new horizons and see what's possible.
Because our potential has no limits.
Discover new horizons at the 2022
Rotary International Convention in Houston, Texas.
Come, let's discover new horizons at the 2022 Rotary International Convention, Houston, Texas.
Well, awesome. I know our President, Teresa Holmes, is excited to lead a delegation to the convention, and having it in the United States, making it close. I hope that you guys consider attending. I have not attended Rotary International Convention yet, but from the people that have, they said it's an amazing experience, and I hope you give it a thought about attending that, because it should be really incredible. And Rotary International has a registration fee of $495 if you register by February 28th. And you can find more details how to register on Rotary International's website. So, a few other quick announcements. Our Community Projects Committee has a volunteer opportunity for the River Food Pantry on March 16th from 3:45 p.m. to 6:15 p.m. And they're seeking 10 Rotarians to help out as a group starting at 3:45. And there are a few flyers at each of the tables today with more details. And you can contact the Rotary office if you can help out, provide service above self. It's really a great opportunity there, and I know they appreciate it. And as we continue to follow the Dane County Public Health Guidelines, starting next week, Rotary's Luncheon, face masks will be optional. The hotel wait staff will still be wearing masks, but for those attending our Rotary meetings, face masks will be optional. And I want to mention that starting next week, our Rotary meetings will move back to being video recorded only and not live streamed. If you can't make our Wednesday's meeting, you'll be able to view it on our club's YouTube channel, starting on Friday following our luncheon. And with that, we've got birthdays to celebrate with a bit of humor or wisdom that complements Rotary's mission. We also encourage members to make an age-appropriate gift to the Madison Rotary Foundation, rounded up to 100 for our Club Synergy Scholarship Fund. All right, February 20th, Grace Trozy. February 21st, Catherine Smith. And February 22nd, Don Helfrecht. And Don had an extra special birthday yesterday as he celebrated his 100th birthday. Fantastic. There was a nice video clip on Channel 3 News showing a number of members of Don's church standing outside of his house on Sunday to sing happy birthday to him. Right after Rotary today, for anyone interested, we're going to have some cake with Don to celebrate his milestone birthday. And if you want to join us, we'll be serving the cake over by Don's table right after we adjourn today. So congratulations, Don. That's fantastic. All right, February 23rd, Vicki Enright. February 24th, Dave Ettinger, who shares a photo with us. Here I am in the Amazon of Bolivia, helping to survey the endemic river dolphin population. And then February 25th, Bill Meal. So thanks to all of our celebrants for their contributions to the Madison Rotary Foundation, and please join me in wishing them a happy birthday. Congratulations, everybody. So, with members in the news, Tara Grace wrote an article titled, Starting or Expanding a Business? These Local Resources Can Help, and that was in business.com on February 17th. And congratulations to Jen Savino, who received the American Advertising Federation's most prestigious award on February 19th, the Silver Medal Award, and it's for her contributions to the advertising community and her dedications to excellence. So congratulations, Jen. Okay, so, and now on to our program. The Latinx community is the fastest growing population in the United States and now the largest minority population nationwide. In January, we heard from Balthazar and Endazar Santana, and today we are bringing you the second of two-part series on the prosperity and health of the Latinx residents of Dane County. I had the chance to sit at the table today, and what a delightful conversation with Dr. Teresa and her mother here, who was here with us. So I know it's going to be an excellent speech. And our speaker is Dr. Patricia Tellez-Giron. My wife would just kill me for how I'm pronouncing that, and I apologize. I'll try to get better at that. And who's going to talk about the prosperity and health of Dane County Latinx residents and the community response to providing services for this population. Dr. Giron received her medical degree with honors at the National University of Mexico and completed the University of Wisconsin Family Medicine Residency program and joined the faculty of the same program. She's been the chair of the Latino Health Council in Madison for the past 21 years, and under her leadership, several annual community initiatives have been started. And for the past 17 years, she has been the medical director of a monthly health education Spanish radio program. She is the recipient of several awards, including the 2011 City County Reverend Dr. Martin Luther King Jr. Humanitarianism Award and the 2016 Arnold B. Gold Foundation Humanism Award in Medicine. We look forward to your presentation, Dr. Giron, and we've made a contribution to the Rotary International Polio Plus Fund as a way of saying thanks for speaking with us today. And I also want to mention that we'll have a Q&A for our speaker afterwards as time allows, so please wait for the microphone if you've got a question. I'll also be watching the chat for questions of those who are watching online. So with that, let's welcome Dr. Patricia to the podium.
Buenas tardes. Good afternoon. Oh, mi gran amigo, how are you? We go far, so we're almost family. So thank you for the invitation. But I cannot start this presentation without introducing the most important person in my life and the person that actually made it possible for me to be where I am, my mother, Yolanda Salazar. Okay, and now fasten your seatbelts because there is so much to talk about this that I am gonna try to go really quick, and I hope just to even inspire you to learn more about the things we are doing in the community. So why is that? Where is my clicker? There we go. Okay, so why is that we are talking about this today? Well, the Latinx community, and you're going to hear different terms. So some people like to be called Hispanic, some others like to be called Latinos. We are actually using the term Latinx because it is much more inclusive of all of our brothers and sisters regarding the gender definition that they want to have. So that's why Latinx is becoming much more common. And some other people like to be called Mexicans or Colombians, or, we have different people, but we are all the same humans. So why do we talk about this today? Because now in the United States, we have about 60.5 million people that are of Latinx origin. We are the population that is growing the fastest. And we are also, regardless of what you hear in the news, the majority, we are American citizens. So we have only a few of our brothers and sisters that are still in the United States without legal documentation. Here in Dane County, we are about 6.5% of the population and still the largest minority. And about 70% of people live here in Madison, Fitchburg, and we are growing really, really fast. And the majority of these are actually 44% about are born here in Wisconsin. So not people that are coming from outside, but actually people that are being born here. When we talk about the Latinx, we always talk about the Latinx, but actually among us, we have a lot of diversity. The majority, we come from Mexico, but we have people from all over Latin America, particularly here in Dane County. It is amazing how rich the diversity of the Latinx community is here. And I always joke because in my visits in the clinic, I have patients from all over, and sometimes they say a word that I don't understand, and I say, excuse me, what is that? Even in Spanish. And they say, oh, it's like this in Mexico. So they translate for me because they have friends that are from Mexico. And then I learn that word, and then next time I understand. So even though we have a lot of things in common, there are other things that actually are different depending where you are from. So why is that we come here? I hope I don't have to explain to you why we come here. We don't wake up one day saying, I'm just gonna make my life miserable and go to the United States and don't speak the language and be in danger. So we are basically forced out many, many times out of our countries for many, many reasons. And then there are a lot of misunderstandings about the Latinx community. I told you. And as you can see in this graphic, we have a purchasing power of 12.4 billions. The undocumented immigrants pay about 98.7 millions of taxes. And 88.4% have children that are citizen, and we have a 43.6 power of voting. So we are citizens, we have a political power also. So very important. What is that has been happening here, and why is that is so important for the community organizations to work together? Because there are still a lot of people that do not want us here, and that lump us on the same, group of everybody that, the thoughts of the media, that we are here to do bad things and that we don't contribute to these communities. So that creates a lot of stress, not only the undocumented community, which is obviously worse, but on all of us. When I'm driving and I see a police car behind me, I really get scared. Right? And I'm a citizen, I'm a physician, but I do not want to be stopped because I know, what the climate is. For our communities, this represents a lot of problems because, for example, we have a lot of families that are suffering from domestic abuse, even now more through the pandemic, and they will not report to the police because of the fear of deportation or, other repercussions. So it is very, very, very important. Historically, we have a lot of health disparities. We have greater numbers of diabetes and obesity, higher number of pregnancy among our teenagers, mental health issues, and these were health disparities that were there even before the pandemic. So what barriers do we have? Language access, which actually, and I know that she is seeing this presentation, my dear sister, Shiva Vidarsilaf, with the University of Wisconsin. She has been one of the most amazing person helping us with language access. She is very much responsible for having interpreters now at every hospital and clinic that we have in town, which really has helped a lot for people to be able to communicate with, the medical community and others. So thank you, Shiva, for everything that you're doing. Not only that, but many, many other things. We don't have enough of us. We don't have enough professionals that look and talk like us, and that represents a risk, a medical risk for our community, because many times they don't trust to go to the doctor, they don't go to the doctor. We don't have a lot of resources that are multilingual and that are multicultural. So all of this, as you can see in that slide, is going to represent a risk. But we are very good as a community. We are extremely resilient, so we can survive a lot of things. And this pandemic, I knew that when we were going through this, I knew that my community could do it, but that will need a little bit of help. So I'm gonna share a little bit of that with you. And the thing that has been the most amazing thing through the pandemic is the grassroots community organizations. So I am so proud to share with you how well organized we are in our community. And I was joking at first, but I have my dear friend here, Juan Jose Lopez, that is definitely an icon in our community and has always been. And he has been there even before I was here, helping the community and forming all these wonderful organizations that you can see in the screen. So we are so well organized. We have an arm for the health issues. We have another one for education. We have Voces de la Frontera that does all the political advertisement and help. And then we have wonderful organizations that are also working with us, like Centro Hispano. And I see some of the Centro Hispano contributors sitting right there with a red sweater. Thank you very much for all that you do, because it really helps. And, many other organizations. I'm extremely thankful to my Department of Family Medicine and Community Health, because for 22 years, they have been supporting my community through supporting me at work so that I could continue doing the things that I do in the community. But it is a teamwork, it takes all these organizations to really work together and be able to provide for the Latinx community here in Dane County. Without all these organizations, I don't think we will be here yet after all these many years. And again, with contributors like you that give us resources. I represent the Latino Health Council, so we have to talk about the Latino Health Council, and we have been in existence over 27 years, and as you heard, Shiva and I have been co-chairs for the past probably 22, 23 years. And we are very committed to improve the health of our communities here in Dane County and beyond sometimes, because we also help people outside of Dane County. Before the pandemic, we will have an annual health fair that we have been doing for over 25 years, and different conferences that will benefit with education one-on-one to the community. However, when the pandemic started, we had to stop. So we haven't done our in-person things for a couple of years, but I'm already working on restarting those because they are really important. But the last activity that you see on the slide has been instrumental through COVID to be able to give the education and the information, which is the radio program. So we have been doing the radio program now for almost 18 years. Every month we do a 2-hour program where we talk about health issues, but also offer community resources, and then also provide other resources to the audience, allow them to call in with questions. So COVID comes in, and we knew that we already were suffering because of the health disparities that I was talking before. We knew that it was going to hit our communities the hardest for the reasons you are going to be seeing now. We still had the same previous disparities that we had before. Obviously, Latinx are overrepresented on essential jobs and cannot stay home and work from home. They had to go out and continue working at the hospitals, at the restaurants, cleaning, all of that. So that made it very hard for them to stay home. We have a higher level of poverty, and many of them could not take advantage of the safety nets that the government offered because they were undocumented. So we knew we needed to do something to be able to provide. So even though it is a health crisis, we knew that financially it was going to hit hard our community too. So we couldn't just not do something about that. And when the pandemic started, I can tell you that nobody came to us. I don't know, Juan Jose, if someone came to you, but nobody came to us and say, oh, this is gonna hit your community the hardest. Let's help you. Here is $1 million for you to be able to provide. No. The same organizations that you saw before, we organized and we said, we have to do something. Seriously, it was almost the day after they declared this emergency. All of us got together and started saying the first needs are going to be, financial need. Our people are going to need money to be able to stay home if they are sick, to pay the rent, all of that. So through the Latino Consortium for Action, which is an organization that actually has representatives of all these other organizations that I talk about, we were able to raise about over $1 million. And commercial, we are still raising money. So if you have any extra money, we can take it, because notice even when the masks are going, COVID is still here and our people are still being hit the hardest. So we are still providing from this funding financial assistance for our people, and they have been, I remember the next day we opened this for people to apply. We had about 2,000 families applying for this. It was amazing, and we were not able to obviously provide for everyone. We had to organize among ourselves and distribute all this funding. We also knew that at the same time, we needed to educate our people and help them gain access to the system so that they could be tested, they could be treated, they could understand why they needed to be home if they were sick. So as I mentioned before, the media has been amazing. So the radio program, we were right on the radio program, and we started informing people how is that they could protect themselves. We also started doing a multimedia campaign, and we had our soldiers, I call them my students that are in pre-med that were ready to go. And I say, we need your help, we need you to talk to the youth and tell them about why they need to protect themselves and their family. We started having resources at our Facebook page, and we are still doing all of these things that I am mentioning. Mental health was amazing because, as you kind of hopefully got from my presentation, our people were already stressed, right, with all the other things they were dealing with. And then these hits and the stress just went up horrible about our families, you know. So we started providing a strategy actually for the general community where we will provide videos with support about stress, what you do if you are diagnosed with COVID, what if you're waiting to hear about it. And then we also did an individual campaign where we gathered several of us that work with mental health, and we started providing one-on-one support for people that were in need. And that was amazing to be able to provide this. Then my mother that I told you that she's amazing, she has been working from home from day one. She has been calling all the elderly that she knew week by week to make sure that they were okay, that they didn't need food, that they needed transportation to appointments, that they knew where to get, you know, resources, and just to talk to them, just to say, I'm here for you. Now my mom is recruiting for us. In a little bit, I'm gonna tell you about these other things, so I don't know how we will do it without her help, and obviously for me too. We had to advocate for a community site that was culturally and language appropriate for us. So we were able to get it. So we have a testing site in the south side of the city that has bilingual people. They say, okay, you want bilingual people? We don't have bilingual people that could do this. And we said, no problem, we'll get it for you. And I personally started recruiting people to be able to provide the services that were qualified to assist with testing and now even the vaccines. And then we also work with the Latino Chamber of Commerce. So again, this is a team effort. You know, we work with Centro Hispano, we work with Academia Latina, everyone that you saw on that slide. We are working together to be able to do this. So with Latino Chamber, what we started realizing is that many people might not be listening to the radio, might not even be looking at the TV and all that, but they will have to go to the store to get their tortillas and their cheese and all that. So we say, let's work with the business owners and have posters with information, give them masks for their employees and also for their customers. Then we had tables, information tables with the businesses also with all these materials so that they will know. So for 2 years now, we have been providing posters for them, very nice posters that they can put on the door so that when, you know, the clients come, they know that they need a mask, why they need a mask, now why they need a vaccine. So that has been an amazing collaboration. So then we got a vaccine, right? Yay! I don't know you, but for me as a health professional, it was amazing when they say we have a vaccine, and I was first in line to really get the vaccine. But I didn't want to be selfish. I didn't want to be the only one to get the benefit. I wanted our communities to really be able to do this. And historically, again, we have been left behind. We have been in the shadows. We are not here. Many people don't even know that Latinx have been here for over 100 years. 100 years in Wisconsin, right? Like we're here to stay, but many times we are not seen. I didn't want that to happen to our communities. I wanted them to be number one on getting the vaccine. So we started working. That's my mom getting her vaccine. She was one of the first ones. So when somebody will tell me, so will you have a family member get it? I say, there is a picture. My mom, as soon as we could get it, she got her vaccine. So we started doing a campaign like say yes to the vaccine for me, for you, for our community and our communities. Because it's very, very important to know that if we are sick, you get sick, right? So hopefully it was clear through this pandemic that we could not just say, I don't care what happened to others, I just want to protect myself. Well, I have news for you, with this pandemic, if we don't protect everybody, we cannot protect ourselves. And that's what we are trying to do with our communities, is like by helping them be healthy, we know that we are also helping the community at large. And that's why we need resources, right? So we were actually able to get some funding from the public health, Madison and Dane County, initially to be able to do some of the education. And now we have had 2 grants with the Department of Health Services. And we are very, very thankful because thanks to that, we could do more radio programs. We can do commercials that are culturally and language appropriate for people. As we were going up on who could get the vaccine, we kept on changing the messaging. So now 5 to up, you can do it. Let's do it together. You need information. It was difficult for people to sign in, for example, for the vaccine, because for maybe all of you, you go to a website, you get in, you sign in, you get your appointment for the vaccine or testing. For our communities, that is very difficult, the language access, the electronic access. So what is that we did? We partnered with UW Health. Again, thank you, Shiva Vidar-Silaf, because she had a vision, again, as I was talking before, that we wanted to be first in line. So she went to everyone there and say, I need equity days. I need to have days where I could reserve for communities of color. And she was granted. So thanks to that, we have been now recruiting from my home, from my mom, because people can call there anytime during the day, almost during the night, Monday through Sunday. When in other places, they needed to again call Monday through Friday, 8 to 5, and they were working and they did not have access. So now we just receive calls at home. My mom takes their name, their birthday, and then she has a list that then she forwards to the university hospital, and then they are called in Spanish to get their appointment. And it has been so extremely successful that I am happy to report that from the population 18 and over in the Latinx community, we have 91% vaccination rate. So we hope to think that it is because of all these things that we have been doing well, that I just described. Unfortunately, yet in Wisconsin, outside of Dane County, we still have about 52% among the Latinx community. We still have to work very hard with the boosters, because now we have to explain to people why the boosters are necessary. And we're working also on the population 5 to 11. But we are not going to stop. We are gonna keep going, because we know our community needs it, and it needs it from places that are, trusted. So this would not have been able to happen if we wouldn't have worked for 27 years already with the community, if we would not have worked among, helping each other with all the organizations that I presented to you. We are just so well organized in our community and helping each other that's why it was so easy, to do it It would have been much harder to do it if we were all working, in different places and if we didn't have the trust of people here. So I'm just going to finish saying, well, what is needed? Now I got you all excited, like I want to help, I want to do something. So if you work in places where you do data collection, we need better data collection because otherwise we don't count if we don't have a number. We need to increase the number of Latinx professionals working everywhere, but particularly for healthcare. And we need to improve and increase the services and resources. Again, we have these organizations that are working, but we need money. We need resources to be able to do the things that we are doing. And sometimes we work with very, very little budget to be able to provide for a community that is really growing. So, muchas gracias. And I almost did it. I think I went past a little bit, but I think we might have a few minutes for questions.
Can you hear me there? Dr. Giron, we've got a question here in the chat, and it says, what community resources for Latinx adults age 55 plus are needed? And what are the highest needs in this age group, and how are they currently being met?
Great question, and I do have a great answer too. So my mom was actually the leader of our wonderful elderly in the Latinx community for like 25 years. So she is now part of that group. So we have about, I'm going to say 200 seniors that are within Newbridge, that previously was Northside Senior Coalition, and about 60 that meet regularly, and now through COVID, about 20, because many of them did not have access to electronics. They have many needs. Transportation is one of the main ones because they don't drive and their family members are busy with work. So transportation for doing their grocery shopping, to events, to medical appointments. Many of them do not qualify for Medicare or any other assistance because they are here undocumented. Then for the groups, money for dinner. Even that, sometimes they meet and it's the only hot meal they have. So definitely that. And then for activities, they love to go out. They love, like they used to go to Milwaukee, but now they don't have a lot of resources. And now through COVID, it has been very difficult. So many needs, but we have the connections. If someone is willing to help, they can talk to me and then we can make plans for that.
Dr. Tellez-Giron, that's the way you pronounce it. Dr. Tellez-Giron, muchas gracias por todo el trabajo que hace usted. Ya sé que reconoce otra gente. I know you talk about other people, but you deserve a lot of the credit yourself. And she has a great brother and a great sister also that are big time. So her mother has done a good job raising her and her two siblings.
I think so.
You have a question here.
I know, I got the question. Dr. Tellez-Giron, you talked about the 52% outside of Madison and Dane County. Why can't we replicate the efforts that you and the Latino Health Council have done to make sure that our booster our shots and so forth are expanded beyond Madison and Dane County? That's my question.
I think that, again, this pandemic is showing us the need and the power of collaboration, right? But to be able to collaborate, we need resources and we need time. So for example, I only talk about the community things that I do, but I also have a full-time practice at the Wingra Clinic. I teach, I do mentoring, and I try to have a family on the side. So, there is only some time and some people that are working here, right? So as much as we wanted to extend all of this outside of Dane County, we did not have those resources. So if we will have more resources, if we will have more pay time for the people we're working with, we could enlarge our arms and go out of Dane County and say, look, those are all the things we are doing. How can we do it? We have tried. We actually have made connections with other people and make our, things available. We say you can use our commercials. We can do, actually, we have done over 100 forums, education forums now, to talk about the vaccine and COVID. So we have done some things that extend beyond Dane County, but I think resources is what has limited us to be able to help more. Thank you so much.
All right, and thank you for speaking with us today. That was really fantastic, and we really appreciate all that you do for our community. When we talk about Rotary service above self, you really live it every single day, and we really appreciate it. I know we're a better community because you're here and all the efforts that you provide, and your mom too. So it tells you that apple doesn't fall far from the tree. I can tell that already. So thank you for that, sincerely. And with that, I also want to remind people that we do have Rotary clothing available. Here's a sweater, for example. We've got some Rotary shirts. Brian's wearing, I think, a Rotary shirt back there. We've got, there's a coat, pullover sweaters, things like that, all provided by Land's End. Jennifer Weitzman worked super hard to be able to get our logo accepted and be able to put onto Land's End clothing. And so that's actually, they're hoping to go more even international, but definitely national with it. But we were the first Rotary Club to be able to get approved through Land's End. So if you get a chance, check out the stuff. It's obviously super high quality and helps the company out here from Wisconsin. So think about that. And then a reminder for those that are interested, we'll now move over to Don Helfrich's table. And we're going to have some birthday cake, whoever wants to help celebrate his 100th with him. So with that, we are adjourned.